Welcome back, Richard. It's good to see you. We have a bit of a tough topic today.
We do.
And we want to sort of put a little warning at the beginning of the show today, because we're going to be talking about some pretty difficult things, especially for parents and families who have and kids who know people who have kind of gone through some of these issues. We're going to be talking about suicide today, and we're going to be talking about sort of some of the risk factors and some of the alarming numbers that we're seeing as it relates to children and teenagers and the rising rates of suicide attempts and completions that we're seeing at that age level.
Right. Yeah. Some things. There's a lot of information coming out that some in the first 2 decades of this new millennium, from 2000 to 2020 or 2021, 22. There's been a sort of a dramatic increase in mental health issues. And I guess it was all triggered by the pandemic, that we're saying we're trying to figure out why the increase in mental health issues. But along with that comes this alarming rise in suicide rates among children and teens. Right. And that's, I guess, the alarming part is it's also among children. And it's one of the scariest things I think that any parent faces. When a parent comes in, they'll say, well, my child is saying he doesn't want to live anymore, or we might be better off without him, or I'm too much trouble. Should those things be taken seriously? And what should we do about that? Is he serious? And so it's a serious topic that's, while it's difficult to talk about, really does need to be discussed, because very few of us know exactly what to do when confronted with this. But I think what we'd like to do here is talk about the increase, but also what to do about it. What should parents and other teenagers do about it?
Absolutely. And I think that, again, kind of loading things up front, it's again a difficult conversation, a difficult topic to discuss. One that needs to happen, but a difficult topic. And we're talking about it based upon data that's been published and some information that's out there that has been published. And we're going to offer a variety of resources in the show notes so that you can read some more. But there has been a significant increase, and we're going to kind of go through some of those statistics in just a moment. But as I'm working in the schools now, one of the things that we've noticed, and just about anyone who's working with students in the schools can attest, there's a significant increase in just the number of students talking about it. I have a couple of elementary schools that I work in, and even in those schools, it is remarkable the number of students who make statements that suggest suicidal ideation, that they don't want to be alive anymore, that they should have never been born, or that they just want to die, or and it's really difficult, because on one hand, that there's some students who say it because out of frustration, out of again, if we're just being honest, to get out of something that they really don't want to be involved in, a lesson or an assignment that they don't want to do. Some say it because of interpersonal social relationship issues. Very, very few students who make those statements really acknowledge that they want to. When you interview them and you talk to them afterwards, they say that they said it out of anger, or they say they just needed a break or something. But any statement that's made about it, we have to take seriously. And that is where we get into this dilemma of, what do we do about it? How do we know if it's serious? How do we know what's going on? So we're going to be talking about a variety of cues or warning signs and some of those kinds of things, but recognize that man, it is really difficult to know what's really going on inside a student's mind or a kid's mind or a teenager's mind, as they're experiencing some of these things. So, Richard, as you said, the past couple of decades since 2000, from 2000 to 2021,
right,
the number of suicide attempts. So this isn't even just someone saying it, because that's what I was kind of referring to, just some kids talking about it.
right.
But the number of suicide attempts quadrupled for children between the ages of 10 and 12.
Right.
We're talking about, we're talking about elementary school kids.
These are elementary school kids, right? Mm-hmm.
And that's a significant increase from 2000 to 2020,
Right.
quadrupled.
Mm-hmm. That's right. And these data, these are from the National Poison Data System. So these are reported attempts.
Right.
And how many went unreported? And these are just poisonings. They're not other kinds of attempts, because frequently you don't know. And so this is just one data set. And so again, we're talking about this 20-year period from 2000 to 2020, where everybody who's looking at this, pediatricians and poison control centers and hospital emergency rooms, are all reporting this very dramatic rise in suicide rates in that 20-year period. Now, as typical, 71% were made by girls, okay? Because girls tend to attempt more often than boys, at least poisonings by girls, okay? Because girls tend to use pills. Now, 70% of the attempts had no adverse health care. In other words, they weren't really hurting themselves. So was it a cry for help, or was it a real attempt? And yet, over 1,000 deaths occurred from this, and that alarms everybody.
Well, and I think that, I don't know how people will respond when they hear that over a 20-year period, there were 1,000 deaths.
Mm-hmm.
We have, there are more than that number of people die from COVID
Right.
on a daily basis. But yet we're talking about, again, remember, 10 to 12-year-olds,
Right.
1,000 deaths over a 20-year period. That's about 50 a year.
Mm-hmm.
That's almost
1
week.
1 week
of kids between the ages of 10 and 12 that are committing suicide.
Mm-hmm.
So that is a significant number.
Mm-hmm.
And when we're thinking about these numbers, I think it's important to keep that in mind, that we're talking about, one a week who a kid between the ages of 10 and 12 who dies from suicide. That's a pretty remarkable number.
It is. That's right. And what brings this into perspective is that in 2000, suicide attempts accounted for about half the calls. Half of the calls were from kids 10 to 12. In 2020, they accounted for 80% of the calls, this same age group. So the attempts and attempted and successful suicide rates are appearing at younger and younger ages. And
Right.
we're going to talk about in very young children,
Right.
the increases are going up. So,
and again, we're talking about calls to the poison control.
This is just one set of data.
Right. This isn't hospital visits for people who are for kids who are cutting themselves or anything like that. This is just data from poison control.
Right. And you say, well, it doesn't seem like, 1,000 deaths doesn't seem alarming, when you think that COVID accounted for more than that every day in some places. But we're talking about what becomes an extraordinarily serious, sobering issue for parents, because every parent worries about this.
Right.
When you hear about it or you see a TV show, it's every parent's worst, of course, it's every parent's worst nightmare. So the significance is not just in the numbers, it's in the importance of this to parents and families.
So sort of building upon this there's some other data that's suggesting that not only are there more calls, more attempts, but it also appears as though there are more completions,
That's right.
more actual deaths. From between 2010 and 2020, the suicide death rates increased by 50% for kids, teenagers between the ages of 13 and 18. And they doubled for that 10 to 12-year-old range.
Yeah, the alarming part of this is success. It's an oxymoron, but we talk about successful attempts, or what we mean by that are it was a successful suicide because the child died. The death rate has increased.
Right.
So there's a lethality here that we also need to understand. Is it's not just the attempts have gone up, the death rate has gone up as well.
Right. And so there may be a number of reasons for that. It could be that these kids are more serious, and so they are using more lethal means.
Right.
That's usually how we, when we think about the statistics you mentioned earlier, that there's usually a higher percentage of attempts are by females.
Right.
But there's usually more percentage-wise. There's more completions. There's more actual deaths by males because they usually use more lethal means.
That's right.
But we don't know if this increases because they're using more lethal means. They just have access, the availability of more lethal means, or if there's really just that significantly more, numbers-wise, that many more are attempting.
Yep. But we do know that by 2014, these data are from Utah. Utah did a really a more thorough analysis of this than many states did. And by 2014, suicide had become the second leading cause of death among children ages 10 to 14. And I think it was the leading cause of deaths. It was the leading cause of death in the 10 to 17-year-old group.
Right.
Okay. Now that becomes significant.
Sure.
You have all kinds of laws about driving and about, safety issues and seatbelts and helmets. And yet the leading cause of death is not because you weren't wearing your bicycle helmet or you weren't wearing your seatbelt. In these age groups, it was the 10 to 17, it was the leading cause of death in that age group.
Right.
That again gives you a little perspective.
Absolutely. And I think that, we've done podcasts before talking about like social media and some of those kinds of things, but, while it's certainly correlational, we can't say that there's a one-to-one relationship between these things, but, as we look back at the data, you can see that in 2013, the increase in these rates became very apparent. You could definitely see, okay, we had this upward trend in the number of attempts and the number of deaths by suicide.
Right.
So that became very apparent by 2013 and has continued to increase since then. And of course, that is right around the time that a lot of social media really launched and became very apparent. And as we've talked about before, social media is a bit of a paradox because there's plenty of research to suggest that the more time you spend on social media, the more lonely you feel, the more depressed you feel, and the more that you have some of these mental health issues. And so we have to note that there is this relationship between these suicide attempts and deaths and social media and other electronic devices and media and things like that.
Right. Yeah. Because if you look at what researchers do is they look at this 20-year period and they see this dramatic increase at about halfway, about 2013. So at about the halfway mark, we see this dramatic increase. And that's about the time that all these social media outlets were launched. I think the cell phone, didn't the iPhone come out in 2010? Was it 2010 or
something like that?
So anyway, all these things began to appear. Now, does that, we know that it didn't cause it, but we know that rates of mental illness and depression and anxiety increased. We know that children can Google, we talk about the increased lethality. You can Google this. If a kid if a child today wants to know if they're having suicidal thoughts, they can Google it and they can get instructions about how many pills to take and when to take them, and if you should drink alcohol with them. So there are instructions on this,
Right.
sadly. So we always laugh about, well, how do I know how to change my windshield wipers? Well, you Google it, or you go to YouTube. Well, there are Google and YouTube videos that kids can watch. So we don't really know how these two things are related. All we know is that around 2013, the rates of attempts and successful suicides increased dramatically. And that's about the time that all the social media, we're not blaming social media, we're just saying there is some type of relationship that we don't really understand. It might just be because maybe more kids are depressed because of social media. Right. And depression, we know, is related to suicide. Right. So we don't know that effect. And added to that, we don't really know the effect of the pandemic. Right. On rates of attempts or successful suicides. We know that what we do know is that by February of 2021, suicide attempts in this 12 to 17-year-old age group increased by 50% over what they were in 2019. So again, we think the pandemic has exacerbated, made this problem worse. But again, we just haven't had time to do enough careful research to know exactly what the numbers are.
Yeah, because we don't know if it was because of COVID. There's been some research to suggest that COVID itself, the actual virus, can increase risk for some mental health issues, or if it was the isolation, the quarantining that we had to do, and those kinds of things. Again, loneliness is one of the major issues associated with depression and mental health issues that could lead to suicidal ideation. So there's a lot. There's a lot of other factors that we have to examine, but I think that there are some, if you want to say, tried and true risk factors that are out there that we know about, and that we all know about, and that have been around for ages, and things like bullying and being bullied, being bullied, being abused, neglect and abuse. A lot of these things we know that they increase the risk for a person experiencing some of these thoughts and feelings.
Right, that's right. There's a long list of risk factors because, again, we really don't know exactly what, I mean, it's probably different. It's different among, probably different among boys and girls. Boys and girls may engage in self-harming behaviors for different reasons. It could be that they were members of a gender or sexual minority group. We know that rates are higher among the LGBT. It could be gender differences, and it could be age differences. We don't know, but we do know is that parents always ask, well, why would is it even possible? Yes, it's possible. Children as young as 5 are attempting and committing suicide, and parents are always shocked to hear that. But while the risk is small, the risk is real, and we even need to take it seriously when a youngster, a 5 or 6-year-old, starts talking about suicide. I don't know how they know about it, but they know about it. We know that they know about it. Okay, right. So among teenagers in 2020, 19% attempted. And now the difference, though, is that among the LGBT community, 47%. So the rates among teenagers generally are around 20%. But among the LGBT community, they're almost 50%. Right. So again, when you get this minority group, this group that is bullied, that is living under stress, whose parents may not agree with their decision, those kind of risk factors increase dramatically in this group of LGBT youngsters. So their rates go up, but it's because they have more of the risk factors.
Right, and I think that many of us, think about this, especially in this current political climate, especially here in Florida and some other states, where laws are being passed that restrict us, especially in the schools, from being able to talk about some of these issues, and making it more difficult to work with students in a confidential and supportive manner, as they're dealing with and kind of working through some of these issues. But not only are there issues with LGBTQ community and that significant increase, but we also see it, of course, with those who are struggling with mental health issues.
That's right.
About a third of those who attempt, are identified as having depression. And we think, of course, depression, the risk of suicidal ideation, but nearly 2/3, about 60% who attempted have ADHD.
Yeah, twice as many have ADHD. So you say, well, I know about depression, but who would have thought that ADHD is, not only is it related, it's twice the rate.
Right.
We go from 30% to 60%.
Right. And so, of course, we have to think about things like impulsivity and those kinds of things, which also increases our concern a lot, because if you're impulsive and, a lot of risk-taking behaviors and those kinds of things associated with ADHD, the risk of using more dangerous and lethal means is there, and that could increase the rate of death by suicide. But when we're thinking about warning signs, I think that it's so difficult, because the vast majority of people who are depressed never attempt suicide. The vast majority of people who have ADHD never attempt suicide. There is a percentage of people who do, but we can't just say, well, if a person has depression, you have to, that's a warning sign. What we're really looking for are changes. And usually they start out as subtle changes, but then as you look back, they become a little bit more obvious changes in behavior and mood and some things like that.
Right. Yeah, and you have to be careful, because we're talking about changes in teenagers, and what are the adolescent years known for? Changes. Okay, so they're going through all these changes about what hair color, what clothing style, what group do I want to run around with. They're wondering about gender identity. So all this stuff, they're separating from their families. Now, this is normal teenage behavior, and yet it's these changes in behavior that might be the first warning sign. But we're talking about significant changes in behavior. We're talking about a kid who's done well all of his life in school, and suddenly he has absolutely no interest, no motivation, or he dramatically changes his clothing style or his language, that he's obviously running around with a different group. So either the child has withdrawn and is isolating, or they're engaging in reckless behavior, sort of almost inviting catastrophe, or they become very isolated from family and friends. Okay, so one of the warning signs is a dramatic change in behavior. But again, we're talking about a change in teenage behavior, which it comes with the territory.
Because again, all of those same changes could happen with another student, and there would not be any risk at all.
Absolutely not. That's right. That's right. Just because your child gets a body piercing or wants a body piercing or a tattoo, that may come with just being an adolescent. Okay, so again, parents need to stay attuned to these changes in behavior. The second is a change in mood, of course. Okay, suddenly your child, who's been pretty congenial and pretty easy to get along with, becomes very irritable, or very anxious, or begins to have anger, real significant anger outbursts. Those changes in mood are coming from somewhere. They're caused by something, and they need to be taken seriously. Absolutely.
Once again, those kinds of things can happen in a typically developing teenager that has no risk for suicidal ideation. So all of that, of course, increases the complexity and the challenges that those of us who work with this population, have when we're attempting to, explore and understand what's happening. One of this more certain warning signs, I suppose, is when teenagers, or when anyone actually starts talking about death, talking about dying, talking about going away, talking about, not wanting to be a problem anymore, or, I'm always I'm always troubled by the idea of, when we look at like self-harm, like, because we have, what does the DSM call it? The non-suicidal self-injury,
Right.
cutting and those kinds of things. And we certainly would never condone that type of coping and that kind of work with, for teenagers or anybody to do that kind of thing. But it's another one of those significant increases that we are seeing. Many more teenagers and kids are using that strategy to cope with unpleasant feelings. There is some chemistry and biology behind that. But just because a student is doing that doesn't mean that they have suicidal ideation.
Right.
They may be adamant that they have no interest in dying at all, but they're doing that as a coping strategy. And so, again, we have this really difficult, line that we have to watch to make sure that everybody's safe.
That's right. This excessive talking about dying frequently, especially elementary school children, they will occasionally. I'll see a family and they'll come in and say, "Well, he's talking about, well, if he was gone, he'd no longer be a problem, or he's a big problem in the family. So if he was gone, he wouldn't be a problem anymore."
Mm-hmm.
Many kids say that. Does it mean that they're thinking about it? It might, but it really doesn't matter whether they will or not. When a kid says that, you got to stop everything, because they're asking for help. That's a cry for help. Okay,
Right.
there's something going on that you need to understand. May not be self-harm, but there's something going on in this kid that you need to get to the bottom of it, because you don't want the bottom to be self-harm. Okay.
Absolutely.
And so parents say, well, what do I do? Should I ask? Yes. Many parents fear that if they're asking about suicide, that they're somehow putting the idea in their kids' heads. The idea is already there. Okay, even in 5 or 6 year olds, it's there. So by talking about it, you're not making matters worse. In fact, reaching out that way, just talking about it very openly, shows that you care. And that's probably what many of these kids are looking for, is when they mention it, that you don't overreact, but you express interest, and that shows that you do care, and that opens up a communication between a parent and a child. So our motto is, when in doubt, reach out. If you're wondering about it, go ahead and reach out and talk to your kid about it. Don't scare them about it, but have that conversation, because we don't know why. You don't yet know why a kid feels that he's such a problem that he should self-harm, but we do know that there's something going on. So when in doubt, reach out.
Absolutely. And when you think about talking with there's lots of strategies and lots of ideas. And one of the links in the show note is to a Psychology Today article that is about, how to talk about suicidal thoughts to your kid. And it's a nice long article that gives you lots of information. But the ones that we really pulled from is, another link in the show notes is from healthcare, from Utah, and it's talking about suicide. And it is important to think about how we talk about suicide based upon age levels. At different, you're certainly not going to talk to your 8-year-old in the same way that you would talk to your 15-year-old. That's going to be a very different type of conversation. And this link helps give some of that guidance based upon that developmental level.
Yeah. Many parents say, well, when should I start talking about this? Well, at about age 8, that's about the time when kids really start thinking about this in a more adult-like way. By 8 years old, most kids know that death is really final. 5-year-olds may not, but 8-year-olds do. So you say, why 8? Because that's the age of reason. That's the time when you can really talk to your kids about these conceptual things that you couldn't have when they were 8. But again, why wait? Because we know that kids as young as 8 or have thought about it. So with very young children, so what this article does, and this is from the Utah study, and I said earlier that Utah has really done a very good job with this. They've collected really good data, and they have, because of the alarming rates of self-harm in children and teens, they have developed, the state has developed a program. So this is taken from their website. For young children, by young children, we mean probably through kindergarten or first grade. So we're talking about up to 5 or 6. For those kids, keep it very simple and put it in a physical health context, that you can just say to them, they had a disease in their brain, they had an illness, and it overwhelmed them. It took over for some reason, just as you would talk about any other health problem. So how would you talk about explaining death by any other cause? That's how I would treat this, that in general, you talk about a disease, but it's in a person's brain instead of somewhere else in their body. Right. And you can do the same thing with kids in elementary school, but you have to be honest. So in elementary school, honesty is best. Keep it simple. But by elementary school, kids are going to start to ask more difficult questions. Right. Okay? So be ready to answer those questions.
Right. And it's not until middle school that you really are going to start going into some detail.
That's right.
Mm-hmm. And because, at that age, they are looking on the internet, and they are, they're hearing a lot more than we think that they hear. And so you want to correct, and this is huge for those of us who work with kids who know someone who has died by suicide, or right. We need to work really hard to correct misinformation, because rumors and theories and everything get thrown out very quickly, and as adults we can kind of weed through those pretty quickly, but middle schoolers have a little bit more difficulty with that. And all of a sudden you start getting into these fantastical stories about this was what happened and this is what was going on, and there was this massive conspiracy or whatever of things happening that sort of coalesced into this person dying by suicide. We have to clean that up. We have to clear that out and correct that misinformation. You can talk about the person's illness and their depression and what they were going through, but do so in a way that's informative and helps them, look at themselves and sort of develop some insight on, have you ever experienced thoughts of self-harm? Have you ever had some of those thoughts? Because, while this person was going through this and it was really sad, there may have been help that they could have had to prevent them from making some of these decisions. And but all of this depends on the relationship with the child.
That's right. You want to have these conversations with your children. This is life and death when kids get to middle school, but it's middle school when parents and their children start to really have difficulties in their relationship, because the kids are separating. They want more control and the parents don't want to give them to them. Don't do anything that damages your relationship with your children. The teenage years can be tough, especially the early teenage years, but you don't want to damage the relationship, because in order to have discussions like this about self-harm, you need to have a good relationship with your child. Right. You can't have this kind of a discussion if the two of you are always fighting about everything, because this is just going to be another source of argument. So make sure you maintain a good relationship with your child. When you move into the teenage years, the later, middle and late teenage years, you're going to have a similar kind of conversation. So when your child is in high school, now you can talk about mental illness, because now they understand what mental illness is, and they may have had depressive thoughts. They may have friends who have mental illness. They're aware of mental illness. They're aware of medications. So you can continue the discussion you had in middle school and probably talk more specifically about mental illness and the relationship of mental illness to suicidal thoughts.
Right. Absolutely. So as just kind of pulling some of this together, when we think about when we need to worry about our teenagers or our kids and all, we're looking for those significant changes in mood, significant changes in behavior, massive drops in their academic performance, massive issues with friends or acquaintances. If they stop taking care of themselves, if they stop eating, if they stop, just again, kind of self-care types of things. They're talking about death too much. All of these things, like we talked about before, those are the warning signs. But also a massive warning sign is if someone else that the kid knows has committed suicide, or
Exactly.
if an idol or somebody that they look up to, a celebrity, or an athlete or professional athlete or somebody like that, dies by suicide. That those are also kind of risk factors or things that we need to be mindful of, and talking to them at the developmentally appropriate age level is really important.
Right. When I was in Austin, Texas, we had what became known as an epidemic of suicide. A student committed suicide, and within a few weeks, two or three kids from the same school had committed suicide. So we call it copycat suicide. So you have to be careful, because you go to the memorial service and everybody's feeling bad and they're crying, and if you're already in a depressive state, you think to yourself, well, kids think like this, I would like to have that same kind of attention. I'd like for people to feel that way about me. And you get into copycat suicides, or maybe that is a good solution. Her worries are over, or his turmoil and his torment is over. Now he's at peace. And that's the same kind of peace that I would like to experience. So there is one of the risk factors is copycat suicides.
Absolutely.
So what this last section is more about what can you do. It's taken from Johns Hopkins website. They address these issues, do it in a very thoughtful, up-to-date, accurate manner. And they had a very long article, but one of the sections in the article is how can I help prevent my teen from attempting suicide? And I think these are worth going through because they are very practical suggestions. But again, they begin with a relationship. You have to have a relationship with your child in order to have these discussions. And the first thing you have to do is you have to know the warning signs of teen suicide. We've talked about them in the previous section, but you have to know what the warning signs are. So because you want to prevent an attempt from occurring. To do that, you have to open line of communication, not only with your teenager, but also with his or her friends, because it gives you the relationship, and talking to kids gives you an opportunity to step in when it might be needed.
Right. Yeah. A lot of parents of kids that we see, they'll say, well, I knew I needed to bring her in because her friend called or texted me or reached out to me and said that she's making some, concerning statements on social media or something like that. And so, yeah, you want to have that open communication with not only your child, but your child's friends.
That's right.
Go ahead.
Now, so what are the practical things that you can do? Okay, for goodness sakes, keep medicines and guns away from kids. Don't assume that your kids aren't taking your medications. Right. It may not be your children who are taking them, but it could be kids that your children know may say, hey, do your parents take any medication? Can you get me some? Okay. And kids do this sort of stuff. Okay. So keep medications, especially the psychotropic medications that can cause trouble. Keep medicines and guns away from children and teens. There was another shooting, and that was in the news recently, and it was, how did this kid get access to these guns? How did he get access to the guns and ammunition that he brought to school that day? Well, right. Somehow he had access to them, and right. Kids should not have access, because right. Kids do stupid stuff like this. Okay, so that's one way to prevent it, is keep the means of self-harm away from children.
Absolutely. Another, obviously, and hopefully this one is obvious, is if you see that your child is having some mental health issues or substance abuse issues or anything like that, getting them help immediately, being right. supportive of them, listening to them and getting them the help that they need, without being overly critical, without being overly punitive, without insulting their intelligence, without being, very negative and nagging with them. Stay connected to them, get them the help that they need, and connect them with someone that can help them. Even if you're sort of limited in what you can do
Right.
outside of that relationship.
Right. And so as a parent, you need to become informed. Again, it's not likely that a child is going, it's not likely that a child is going to commit suicide, but given how important it would be if they did, even if they were self-harming, you have to inform yourself about this. And the easiest way is just go to the internet.
Right.
We get reliable information from reliable sources. Many medical schools, medical centers have websites. The American Academy of Pediatrics. There are professional websites that you can go to inform yourself and learn about the warning signs. We talked about the warning signs, but know what the warning signs are so that you can recognize them as a possible risk factor for self-harm and suicide.
Right. Yeah. And when you go to those same sites, you're going to find like warning signs for depression and warning signs for suicidal ideation and things like that. So yeah, be knowledgeable about it. Look for those changes in the mood, changes in behavior, like we talked about before. Right. But you know, there are just know your kid and have that relationship with them. You know, I think that's the thing that we're really trying to reinforce here is you have to have that relationship with them. You know, and even if your kid isn't going through it, having that relationship will help them feel comfortable coming to you if they have a friend that's going through something.
That's right.
And so then you can talk to them and you can try to get them some support if they need it. So the relationship is just so important. Yeah.
So there's nothing worth damaging your, and we say this all the time to parents. I can't think of a single thing, not straight A's, not superstar athlete, not anything that's worth damaging your relationship with your children. Right. I mean, there's nothing more important than maintaining a relationship with your child. There's nothing that child will do, not in sports, not in theater, not in music, not in grades, not in getting into Harvard. Nothing is more important. Nothing is so important that you would damage your relationship with your child. So first of all, you take care of the relationship. Everything else will flow from that. And it's especially important with issues like self-harm, where where the consequences are so dire, they're so significant, that you certainly don't want to do anything that might contribute to your child's struggles that they might be having with thoughts of self-harm or suicide. Right. So first of all, maintain that relationship, nurture that relationship, because you want them to come to you first. If a child, I mean, the ideal situation is if the child is even considering that we want them to come to their parents first. Right. But your parents have to be available.
Right. And if you're listening to this and you're experiencing any suicidal ideation or any of these types of self-harming thoughts, or if your kid is, or if you have a friend who is, you know, think about calling there's the National Suicide Prevention Lifeline. It's 1-800-273-TALK. You know, there are loads of resources for, you know, whether even if you're international resources for suicide hotlines. Find a therapist. There are many therapy directories online that you can find a good therapist in your area. Good therapists virtually now. You know, something that's come out of the pandemic situation.
If you don't know what else to do, call the suicide hotline. Those are people who know about this. They know where the resources are. They'll give you good advice immediately that you can start to follow. So don't hesitate.
Right. Absolutely. So again, this is a difficult topic. This is a difficult thing to think about. None of us want to think about it, but it is important that we do, so that we can, you know, hopefully help kids that are experiencing these kinds of troubles and going through these really difficult times, so that we can kind of help them pull out of it and find some support and some help to live a happier life.
Right.
So, all right. Well, I think that's it then for today.
Right.
You know, we'll kind of keep an eye on the numbers and give updates as they come available. So
right.
Until next time, stay happy, stay healthy, and forget to be afraid.